Hello, and welcome to our presentation on tiered supports for students. I'm Rita Brusca-Vega, Professor Emerita of Special Education in the Purdue University System. Currently, I'm a board member and course facilitator for NTSS. I am also a consultant to schools in the Chicago metro area on English learners with special education needs. I will be speaking with you today from my perspective as a former classroom teacher, helping students get the support they need. This presentation expands on the topic of student support teams, a subject that you studied in a previous session. I'll provide an overview of the system of supports to students referred to as MTSS. As interpreters, you are likely to be involved in the tiered support process when there are team meetings with parents about interventions and student progress. You may be called upon to interpret how MTSS works, what tiered support means, and draw on your knowledge of terminology related to assessment and instruction. Providing students with support when they need it is nothing new in education. Offering tutoring sessions, adapting class assignments, referring students to counseling services, and many more supports have taken place in U.S. schools for years. What is new about MTSS is that it provides a national protocol for delivering this support. This includes identifying students who need help, deciding on interventions to be used, and most importantly, keeping track of student progress so schools and teachers can be more responsive to their needs. As described in the Every Student Succeeds Act, MTSS involves a comprehensive continuum of evidence-based, systematic practices. This means that a wide range of instructional strategies, all of which have been demonstrated by research to be effective, will be applied in consistent or systematic ways to all students. MTSS also involves applying these interventions rapidly, so there is minimal wait time before academic or social difficulties are addressed. In addition, MTSS requires consistent monitoring so that interventions can be changed, if needed, to better promote success. The force driving MTSS is educational equity and the desire to help all students succeed. There is a strong focus on early intervening or preventative service so that students continue to make progress as they move from grade to grade. This philosophy applies to behavioral and social-emotional learning as well as to academics. There is an equally strong focus on making sure that teachers select and then implement interventions based on published research findings. The type of strategy required is based on the needs of the student. Simple strategies, such as giving students points at the end of the day for good behavior, are considered Tier 1 or universal strategies. More intensive interventions, such as using a special curriculum that addresses behavior problems, may be considered a Tier 2 or Tier 3 strategy. MTSS also provides districts with a framework to organize and add to the interventions that they know will be effective for their student populations. Each state is free to design its own version of MTSS. This is the Massachusetts model. In the white circle surrounding the school icon, you'll see the philosophical frameworks, universal design, and equity in learning, which refer to approaching instructional decisions in inclusive and differentiated ways. In the center of the icon is the three-tiered system of support mentioned earlier, where supports become more targeted and intensive at each level. There are also drivers of the model shown in the outer circle. The purpose of the drivers is to make sure that the model is well planned and implemented. Leadership drivers include collaboration and removal of barriers. Competency drivers revolve around developing teacher capacity for instruction. And implementation drivers help set patterns and structures for functions, including decision-making and data collection. In the next few slides, we'll look at the philosophical components of Universal Design for Learning, or UDL, which deals with expanding the opportunities for students to learn in different ways. Universal design refers to designs that work for everyone, whether we're talking about architecture, transportation, or education. Teachers who practice universal design are always thinking about how to expand options for engaging students, presenting content, and allowing students to show what they've learned. If they have students with print barriers, they'll have audio materials for students to listen to. If they have students learning English, they'll encourage them to write in English along with their other language to get their point across. If they have students who don't get along with others, they'll have supports to build self-control. All of this leads to educational equity. Here are some examples. For student engagement, you might hear teachers talking about offering choices of activities, having students set personal goals, or making sure that their classroom is a safe space so no one feels intimidated when working in a group or giving an answer. For presenting material or representing content to students, teachers might do a role play or give students an outline to take notes. In the area of student expression, teachers might tell parents they'll have students create a model or record an audio file instead of taking a paper pencil test. This concept of maximizing options and reducing barriers is applied throughout the MTSS process. Tier 1 instruction applies to the entire class and should be culturally and linguistically sustaining in addition to having options for all types of learners. For example, most general education classrooms have students who struggle with reading, and they benefit from seeing the print in addition to listening to the narrative. A typical Tier 1 adaptation is providing opportunities for a multisensory reading experience by offering all students the option to turn on speech output and use headphones while reading online. Tier 2 instruction considers individual needs and provides targeted instruction. For more concentrated instruction, teachers might set up learning stations for students to rotate through, or bring a small group together to preview a reading session or talk about making good decisions. Tier 3 instruction is more personalized and intensive and may require push-in or pull-out services by an interventionist who uses methods and materials that are different and more targeted towards specific student needs from those in the general curriculum. The MTSS process begins at Tier 1, where students who need help are initially identified using universal screening measures, which are screeners that are applied to the entire class. Screening tools can be published formal assessments or based on the school's curriculum or developmental standards for behavior. Once students who are having difficulties are identified, the teacher looks to see what changes can be made to the typical instruction or curriculum. Sometimes teachers will make these changes on their own. Sometimes they may bring the issue to the student support team or talk about it in grade level or content area meetings. Most difficulties with learning resolve with simple Tier 1 adaptations. When changes aren't successful, the teacher moves to Tier 2 instruction, which is more targeted and individualized. At this point, the teacher will typically bring the issue to the attention of the team in charge of the MTSS process. In many cases, Tier 2 instruction is successful and no longer needed after applied. In other cases, the student's progress is dependent on the intervention, and the student continues to receive it. In a smaller number of cases, Tier 2 instruction may be unsuccessful, and then a move to Tier 3 instruction is made. In Tier 3, instruction may be done on an individual basis and involve methods and materials that are not typical on the general education curriculum. When successful, students may continue to receive instruction at that level or move to less intensive interventions, depending on their needs. When intervention at Tier 3 is not successful, the team will often request a case study evaluation for diagnostic purposes, and that may lead to a recommendation for special education services. It is not uncommon for students to receive various tiered interventions in 2 or more areas. A student might do well with Tier 1 supports in reading, but need Tier 3 interventions in math. Or a student might need behavior support at the Tier 2 level and Tier 1 support for academic work. While many interventions in the MTSS process deal with academic issues, MTSS is also designed to support students with social and emotional needs. Challenges can range from depression and anxiety to acting out verbally or physically in class. Sometimes problems can be solved at a Tier 1 level with changes to a teacher's classroom management style or program. Other times, a more individualized approach is needed, where students are taught strategies for how to better regulate their behavior. Behavior contracts are common for completing work assignments or reducing out-of-turn talking in class. In some cases, the team may recommend outside counseling or other social service resources. Points of discussion in the MTSS process typically revolve around how many interventions should be tried before moving from tier to tier, and the length and intensity of the interventions. The best answer to questions like this is, it depends. Changes in reading comprehension, for example, do not happen in a matter of days, so interventions may need to be implemented for a month or so before decisions are made. In the case of behavioral interventions, teachers are likely to see effects quickly. The composition of the team that makes these decisions varies. In larger schools, grade-level teams may handle the MTSS process, bringing in specialists as needed. In other schools, there may be a multiple grade and subject area student support team that handles MTSS. Individual teachers and specialists also have a role in the decision-making process, as they have day-to-day experience with the student and are most knowledgeable about strategies in the subjects they teach. When to bring parents into the process may also vary by district and school. Some teams may communicate with parents when a student starts to receive Tier 2 intervention. Others may involve the parent when a student is at a Tier 3 stage. Finally, what can you do as an interpreter to help prepare for an MTSS meeting? In addition to your typical preparation for interpreted sessions, such as asking for test scores and progress reports to review, you could also ask whether the parent or family member has been to an MTS meeting before, whether the student is receiving Tier 1, 2, or 3 interventions, and whether the concerns are in reading, math, social, or other areas. If you work in one district or school consistently, also consider asking a team member to explain the composition of the team and how the process is implemented locally. Being familiar with general procedures and materials used by teachers for testing and instruction, things that are likely to be mentioned across MTSS meetings, may help you feel better prepared.